All righty, we are recording and it is January 23rd, 2025. As always, statements made in this presentation are not meant to treat, cure, or diagnose a disease. For those of you that don't know me, because there's a lot of wonderful new names, I'm Daniel Benning from Biotics Research. I've been with Biotics Research, oh gosh, I'm looking at the calendar. In a couple of weeks, it'll be 27 years I'll be going into being a representative here in Arizona, covering New Mexico as well. And so today is Daniel's Downloads. We're going to cover cardiolipid labs. Last April of 2024, I did a class and we launched cardiolipid. And now I got to, sometimes you're like, does the product really work? I'm going to show you some amazing lab results and some great stories. And then I have a brand new product release for those of you that are on. This is going to cover a lot of bases in gut health. And we just released it. It just came into our warehouse as of yesterday. Let's dive into it because I can get a little bit wordy at times. Cardiolipid is the product we're going to discuss initially. So this was developed by Dr. Mark Houston, who's out of Vanderbilt. Many of you know him. He's lectured for biotics. He lectures at A4M. And take a note, just as I'm going to touch base on it right here. 270 capsules in a bottle. Because as you see what I talk about, you're like, oh my gosh, that's a lot for a patient. Well, this is a 2 to 3 month supply from what I'm seeing in the laboratory results. All right. So the reason for a product like this is 100 million people are prescribed statins, but 52% don't tell their doctor that they might not take the medication. I encounter a lot of my practitioners in the state of Arizona here, and a lot of them say, well, the patient came to me, they don't want to do a statin because they've heard about the side effects from their friends, but they really need to adjust their lipids fast. Or again, here we go, primary care won't work with them. So the patient wants to work in both worlds, which I respect. But now you all have a phenomenal tool in your toolbox. We've talked about it, like I said, but now I need to show you the results. So lipid-lowering drugs, patient refill rate, 25% do not fill their script. Another 25% do not fill it on the second refill. Be aware of that. This is a conversation piece for your patients. If you're working at all in the cardiovascular arena, which I'm seeing more and more of, we really learned a lot about health during this little period a couple years ago when the world was in a viral storm and people became more conscious about their health. So is the unaddressed patient in your practice? Yes, yes, they are. Patients are looking for safe, effective, natural alternatives without the negative side effects. Time and time again. I have some doctors in East Mesa, and he shared with me, the patient came to him and said, as I said to you earlier, my numbers are bad. The doctor wants me on a statin. I don't want to do a statin. What do you have for me? Now, I don't like Band-Aid medicine, okay? And a lot of even what we do kind of is. But I would hope as you would look at a product like this, we're also taking the time to educate the patient and have them commit, which is difficult, commit to a better lifestyle program. So here's what's in this product, the right ingredients, the right dosing. You're all familiar with red yeast rice. And look at the bottom. Let's clarify this right away for those listening in and can't see the slides. This is a dose of 3 capsules 3 times per day, 9 a day. I'm sharing with you, I've not seen that need unless a severe case. So 9 a day, your dosing is red yeast rice at 2,400 milligrams. That's an HMG-CoA reductase inhibition. You're inhibiting cholesterol production. Phytosterols, compete with dietary cholesterol for absorption. The aged garlic, inhibition of cholesterol absorption as well, and synthesis. Berberine, you're all familiar with berberine. You've all seen the studies. 500 milligrams. And then the delta tocotrienols, which again is suppression of the HMG-CoA reductase enzyme. Now, that's at 9 a day. I want you to think about what we're going to show you is we're using a lot less. Think of the synergistic components of these nutrients, okay? Cardiolipid labs, this is patient number 1. I'm going to back up before you get to see all those numbers. So look for the Tuesday Minute if you've not seen that. That's done by Joe Bush's. It's about a 5-minute piece. We have them archived on the Biotics Research website. I helped him do the last one a little while ago on cardiolipid. We showed you some labs. These are brand new laboratories I'm showing you. Nobody's seen these yet. These are brand new laboratories from one of my doctors here in Scottsdale, Arizona. He has treated well over 100 patients with cardiolipid, okay? I met with him a couple months ago, and he goes, Daniel, I don't know what it is. I've never seen a product work so well, even for himself. I said, doctor, could you kindly send me 3 patient cases, obviously delete their name and show me those numbers, okay? Wait till you see these numbers at only 3 capsules a day in short order and no lifestyle change. Patient number 1, this was from October 3rd to December 19th of 2024. Cholesterol, 327 to 228. Triglycerides, 196 to 122. Look at your cholesterol HDL ratio of 8.2 to 5.1. HDL went up a little bit. Your non-HDL obviously shifted from 287 to 184. And look at the LDLs, the 252 to 160. And everybody asked me about ApoB. And many doctors don't test for ApoB. But when we shift LDLs down, ApoB should go with it. These are, in my opinion, pretty dramatic numbers from a product like this. And you saw the dosing at 9 a day, and this person's only taking 3 a day. So it's that synergistic component of all of these nutrients having this impact. Let's look at patient number 2. Cholesterol. This is a June 19th to September 30th of 2024. Cholesterol went from 298 to 225. Triglycerides did go up here. So then the question is, okay, what was this patient's lifestyle shift? And yet, I'll speak personally, I'm not shocked by that triglyceride number. I like my triglycerides half of cholesterol. That's what my mentor taught me. Now, is the 225 cholesterol too high? I'm going to say not in my opinion. 298, maybe we're pushing it a little bit. So then look at the HDLs. They did go down a little bit in this case, but look at the LDLs, 230 to 154. That's a big shift. And the last patient case is patient number 3. This was, I think, one of his starts because we had just launched this product. So this is April 3rd to June 19th, ironically, same day as the last patient was drawn. But here's your cholesterol, 218 to 146. Triglycerides, 165 to 131. HDLs went down a little bit, but here's your LDLs again. The one that many of us are looking at is 148 to 80. If you are doing standard labs, this is pretty powerful information. Now we know we can go to many, many further steps with looking at lipid profiles. But as a standard in the industry, these are pretty impressive numbers on a supplement. And by the way, the patient that I was talking about from the Mesa doctor shifted the labs very dramatically, went back to primary care, didn't believe what the patient did, but had no justification then to require a statin. So those are good stories. This is what we try to do in this industry. We try to create great stories, and we're all very capable of it. So let's review the ingredients. Red yeast rice. It contains monoclocolins. That's the active ingredient which inhibits that HMG-CoA reductase. Now, I can tell you we look for that ingredient, and I can tell you red yeast rice in the industry varies all over the map with that ingredient, but I can't publish that amount of that ingredient based on certain powers that be that are out there that would say then now you're calling it a drug. Okay? So just be aware. And then here's the synergistic component I'm talking about, the powerful synergistic. Berberine, enhanced insulin sensitivity. You know this. But look at that. Berberine activates AMPK. That's your metabolism enzyme. Aged garlic. You're lowering interleukin-6, a pro-inflammatory cytokine. It's helping with fasting glucose. That's And I don't know, but I'm really seeing and people feeling that that's a big impact with this product. Then the phytosterols, anti-inflammatory, antioxidant properties, reducing the production of pro-inflammatory cytokines, like I mentioned, interleukin 6, and tumor necrosis factor, which is another pro-inflammatory. Inflammation is where it's at. If it's whatever it is in health, your patients are chronically inflamed. I feel, as we've discussed over time, a lot of it is it's at the gut level, that these people are terrible diet, terrible probiotic, terrible fiber, just things are a mess in the gut. That there's a lot of this inflammatory process happening. Phytosterols improve insulin resistance and reduce both inflammation and liver enzyme among patients with non-alcoholic fatty liver disease. And then the delta tocotrienols improve hepatic steatosis, improves insulin sensitivity. So think of what is hepatic, I can never say that word, I apologize, steatosis. So it's fat accumulation in the liver. Causes, I made some notes here. Diet, metabolic diet, nutrition, drug-induced, viruses. There are genetic components, there are autoimmune components, and alcohol. So things that we as practitioners need to address with our patients to help clear up a lot of these factors. Again, this is a wonderful, wonderful supplement. But again, we need to work on them with lifestyle. Think of them what the numbers would be. This is an extremely well-documented product, data supported by meta-analysis. So when looking at the literature, as I showed you with the slide before, how these nutrients impact metabolism and your enzyme pathways. This is, years and years ago when I first got into this industry, I was telling a phone call this yesterday. 30 years ago, when I was in Wisconsin in the clinic, we were a bunch of quacks. We didn't have the supportive literature as we do nowadays. You can't argue this stuff. And I wish some of our primary care could think outside the box and actually look at more of this. So here's your dosing chart. I've sent this out before. I'll send it out again. I'll make a note to do that, to send out the dosing chart along with this recording for all of you that are here and for all of you that were not able to join me today. But this is what we put together at 3 capsules per day. You're looking at a 22% reduction in LDLs. But here's your price point. People panic. Perception is key in everything we do. Whatever you sell as a modality or whatever you sell as a product, perception is key. We have to go way beyond just price, but we have to look at what's the bang for the buck and what's the value. So your retail cost for 270 capsules is $96.90 retail. Oh my gosh, doctor, that's a lot of money. Well, geez, your lipids are a mess. Your doctor wants you on a statin, but let's really break it down into, you're maybe in the $32 to $64 range a month for a couple months until we get you cleaned up, and then we can reduce it down even further. This is what takes a little bit of time, I understand, but we need to explain to the patients, because guess what? What do? They panic, $96.90, and I'm going to go shop somewhere else for something much cheaper and a much lower quality. So take that little bit of time. Don't panic with that price point. I haven't, and I know the doctors that I'm working with have not, because of the results just to speak for themselves. And the dosing, I'm being honest with you, I haven't had anybody need to get to 9 a day. I've seen a few cases out there from other parts of the country, but these weren't patients that faithfully took it. So they went 9 a day, dabbled with it, and they still got results. Where these patients from the doctor I'm talking about did 3 a day consistently and knew, wow, $32.40 a month for 3 a day, I can do that. And the results you've seen in a couple months is amazing. I'll send you this dosing chart. So there's the ingredients at 3 capsules a day. All right, most of you are saying, well, that's not like an overly therapeutic dose of red yeast rice that we've talked about in the past and that everybody looks at in the literature. And same with all of these, even berberine. We're all thinking, well, most of the literature is 500 milligrams a day at minimum. Again, it's the synergistic component of this. And I love it when we do products that have synergy like that. And you're seeing the results. It speaks for itself. Again, I hope if you have questions, I'm always here for you. To the people that are new listening in, let me be your resource for information. I've done this a long time, and I have the luxury of learning from all of you every day. All right, that was cardiolipid. Obviously, you can tell I'm pretty excited about it because the lab work, you can't refute that. Now we're going to shift into a brand new product called Motility Zyme. It just reached my warehouse yesterday. This is one of the most cost-effective products I've launched in a long time, based again on patient perception. But here is the need. On this phone, Medscape every day, again today, GLP-1, GLP-1. And we've talked about it a lot, but I'm going to keep going at it because the stories I get from my wonderful community of doctors is scary. These patients' GI response from taking GLP-1s is not good because they want the quick fix. I'm okay with that. That's okay. But what are we doing with it to stay healthy? Are we eating properly? Most of them are not. Do we have proper GI motility? Most of them do not. Let's dive into that. So, are your patients constipated? This even goes way beyond GLP-1. We're going to talk about all the other areas. And this has been the area, when I came out of college and I worked for Dr. Robertson, and, he said, Daniel, as I've said to you before, and being respectful here, but, if they come in with hangnails to hemorrhoids and you don't know what to do, fix the gut. And when you questioned a patient, do you have regular GI motility? Are you having a regular bowel movement? Oh, yes, no problem. It's wonderful. And then you really dig into it and it's like every third day, every fifth day. That's not normal. That's not wonderful. People's perception, again, adapts. So what are we talking about? Fewer than 3 bowel movements per week. That's constipation. Stools that are hard, dry, and lumpy. That's constipation. We live in Arizona. New Mexico's listening into dehydration. Okay, that's a whole nother story. But here it is. Studies estimate that between 25 and 50% of people who meet these formal criteria do not self-identify as constipated. Please, we can talk poop all day long. It's what we do. It's what I do. I have no problem talking poop all day long because this is health. That tube, north to south, if it's not functioning properly, if it's not fed properly, you have all the systemic inflammation and truly, in my opinion, most of the disease processes. I was just on the phone yesterday with a doctor in New Mexico talking about a constipated patient who has terrible hormonal problems. Well, guess what? You conjugate glucuronidation, phase 2 in the liver, metabolizes estrogens out. And then it hits a slow colon. You're not eliminating it. You're reuptaking. You're disassociating the estrogen, and you're uptaking the estrogen. A cycle of ill health. So, huge importance here. Question your patients because this relates to whatever you are doing. And look at the perception. 25 to 50% of people with these kind of things like, yeah, I'm pretty good, 3 times a week, whatever, we're good. No, you're not. No, you're not. So who's your target patient for Motility Zyme? Well, you see in red in the long list, but let's cover those. We talked about the GLP-1s. I have doctors who are doing GLP-1 prescriptions who are going to add this as part of the package. If you haven't created a package yet of health for your GLP-1 patients, we've talked about metabolic biome fuel, a full, high protein, high fiber, good fat shake. They need to eat better than I got my GLP-1 and I got my Doritos. That's not health. Antacids will cause this for people. We've talked about poor diet. Look at this one. I just highlighted this one because it was kind of like, we don't talk about this too much. Hypothyroidism. I know you all know this, but part of that is constipation. The subjective indicator of classic hypothyroidism is constipation. I think I woke up some ears in the room here. I'm not sure, but I think there's somebody listening in that like, oh, So, see, sometimes I do these just to get other people's attention just in the house here. So we have rebound constipation. These are your patients. Over-the-counter laxatives can cause problems, including laxative use can lead to alternating constipation and diarrhea, which can create this cycle of laxative use and dependency. The bloating, gas, stomach cramps, and feeling sick. You know these patients. You know them very well. Dehydration, as I mentioned, which can cause the headaches, lightheadedness, etc. There's so many basics to helping these patients at some level, but it's tough to get them to be compliant. But what is their hydration level? What is their fiber intake? What is all these factors? I feel for all of you. It's a big job. It's a big job. But here's your wheel: constipation, hemorrhoids, discomfort, OTC meds, 40% of your population. Just go to Walgreens. They're making a lot of money on laxatives. They really are. And then you just exacerbate the issue. Where here comes Motility Zyme. I'll show you the amazing ingredients to this. I'm really excited about this product because it makes a lot of sense. Constipation, there's the hemorrhoids, discomfort. We add in the Motility Zyme, and then we can get to a regular cycle. 90 capsules. You like our new labels, by the way? You're going to get these with all of our new products. You're going to have 3 little silver bullets for you and for the patient as reminders of where this product is used. So the patient can go, why did my practitioner recommend this? Oh, yeah, it's right on the label. That's new from us. So what's in Motility Zyme? Ginger, so gut nervous system enhancement, artichoke, bowel calming. We'll get into more detail. 5-HTP. That's a little different. And then magnesium citrate. Let me segue to, I had a wonderful meeting last week, and the doctor says, well, I just use magnesium, and it works great. And we've talked about the different magnesiums, and that's what pretty much everybody is most familiar, is regulating bowel tolerance to magnesium. But again, I think it's an easy component, and you can't go wrong with magnesium and cause any real problems. But I don't think we could, I think we could do better. And that's why I like this. This is why I like this a lot. So ginger regulates GI dysmotility, stimulates gastric emptying, and modulates 5-HT3 receptors. What are 5-HT3 receptors? Again, they just play a role in regulating gastromotility. It's a hormone receptor based off of basically 5-HTP. We're going to get into that. We're going to jump over to the right here, though, artichoke. Bile flow. I'm so happy this is in here because we have beta TCP. We've had it forever. We use it in our detox programs. If you do not have bile flow, you're not getting rid of your toxins well. We just talked about the estrogen component in phase 2 glucuronidation. If you hit bile that's sluggish and it doesn't move, you're not clearing, you're not detoxifying well. But bile lubricates the bowel. So it's rich in antioxidants, alleviates GI discomfort, and stimulates bile secretion. That's what artichoke is doing. So love that component of this product. And that is, now we're looking at multifaceted components of a laxative type product. I should see you do the word laxative. I apologize. A GI motility product, because here we're looking at getting things working correctly. Why 5-HTP? 5-HTP has a precursor to serotonin and 5-HI, which is designed to both enhance gut motility. 5-HTP is a prokinetic that enhances GI motility. All of these, pay attention, all of these are prokinetics. That is the big talk at conferences when we're talking about GLP-1. We need a prokinetic. This is also the talk of when people do a SIBO program. The post-SIBO program needs a prokinetic. Bowels need to be moving regularly. And I think all of these synergistic components are working at all the functions that we're looking for. The hormonal response of GI motility, the artichoke increasing bile flow to lubricate the bowel. And then magnesium citrate, peristalsis, supports muscle contraction and relaxation in the GI tract. Magnesium is a smooth bowel relaxer. You know that. But, in a nutshell, I mean, we talk about how, like magnesium oxide, that bond breaks very quickly. That magnesium's looking for water, grabs the water, and flushes out the GI. Magnesium citrate at the amount here, we're not causing a flushing effect, okay? So very 4 impressive components for GI motility.
Sound good.
That's a blurry slide. Wow. Okay. So if you can't see it, I can barely see it. This is on me. my design team. I'll have a talk with them. Magnesium citrate is only 50 milligrams per capsule. So it's not a lot. You're not causing that flushing effect. 5-HTP at 50 milligrams. So many of you are going, well, I use 5-HTP at 150 or 200 milligrams for serotonin production. This is not what we're doing. Again, serotonin is produced in the GI, but let's enhance it for that 5-HI response to increase GI motility. Ginger, 150, and then the artichoke. These are your more power components, should I say, to this product. So you're looking at one capsule 3 times per day, used beyond symptom relief. This is the key component. And I don't love to read slides, but I have to read this here. Use beyond symptom relief, continue for a minimum of 90 days. So yes, compliancy at 1 TID, a little bit difficult for patients where the magnesium loading dose on their nightstand at night, I'm going to take 5, 6 capsules so I can flush it out the next morning. Not the ultimate goal. I know people that function like that because it's easy. But let's talk about what's easy versus what's healthy. Okay, even in our industry. This would be healthy for if I was a consultant. So here's your price point. Look at this. $9.95 wholesale, $19.90 retail for a month's supply. You're getting 10% off with the code Motility10. Right, that's through March. So you got time. But if you order 6 or more,
new product called
you get this nice
Motility
patient brochure and stand, which is nice, makes it easier on you. You don't have to take the time to explain it to the
If you really
patient.
want to get shit moving, you can take it up to 5.
Here's my call to action. Those of you that don't know me or those of you that do know me, anytime there's a new product and you call me personally, say, Daniel, I want 6, I want 12, I want 24, I will place that order for you and give you 20% off. My call to action
Yes, because half your
yes,
staff members are
I
full.
know I'm the biotic sales rep, but I'm a
Who's not
clinician
full?
by heart. I know you all know that.
I mean, I got
And I
similar
want to get
peanut
people
last night.
better. And I know what's going on. I met with a nurse practitioner 2 weeks ago. She goes, Daniel, I've got 2 patients on colostomy bags because they reacted so bad to their GLP-1s. My call to action is implement a product like
not listening to
your patient. You know the patient need is out there. So please consider that. You can text me. I'll give you my cell phone number. It's 602-690-9636. Say, Daniel, send me 6, send me 12. Whatever it is, email me. That's my call to action to all of you is I get it. I go to conferences, all day conferences, and the wonderful notes, and then the book goes on the shelf. And what do I implement? I hope in this 35 minutes, I gave you something to implement. And for those of you that have never ordered cardiolipid, the same thing goes for that. It's a brand new product to you and you want 6, I'll give you 20% off. So those are my call to actions today. All right, let's get ready in the chat box. Jacqueline's getting her pen ready. Raffle quiz. The first 3 to answer in the chat box win a bottle of Motility Zyme. As I have surveyed for the past week and a half, knowing this product is coming along, even amongst my practitioners, it is a concern for their own health. So we got to think about ourselves. We got to think outside the box for all those patients that you do have. Great. Here's the question. Which ingredient in Motility Zyme is a prokinetic? Ginger, artichoke, 5-HTP, magnesium citrate, or E, all of the above. So you can answer it however you like, A, B, C, D, or E, or write out the words. Jacqueline's scribbling with her pen very fast over there. And I mentioned earlier on about the prokinetic. What is a prokinetic? Helps GI motility, okay? So is just one of these going to help GI motility, or are all of these going to help GI motility? Do you have some winners over there? We're good? Okay, awesome. All right. I always appreciate you taking the time for these few minutes on a Thursday with me. The winners, I always like to tell them, Isabel, Sarah Rose, and Ashley. You will be getting a bottle shipped out to you. We just got it in yesterday. I'll make a note to get it out to you as soon as possible. Here's my next class, just so you know what's coming down the line. I'm using a new system for emailing because the old system Biotics got rid of. So look for the emails coming from D. Benning at Biotics Research. But we're going to talk about a specialized probiotics, a new women's focused formula coming, and so much more. I know you guys like think, wow, we're talking about the gut a lot. If you have ideas that you want me to talk about, text me, email me, call me. I am happy to bring them up in 2025. But since we have a new formula coming down the line, I know probiotics are kind of the topic again lately, which are important. But let's talk about all the nuances of how to best support the GI with the proper probiotics, because we can do single therapy, but then what about that whole rest of that microbiome? We're going to talk about all that and so much more next month, February 20th. There's my info for all of you that are new. I appreciate it again. I look forward to talking to you. Reach out to me, use me as a resource. We're going to stop the recording and I will open it up to questions.